Hey guys, welcome back to our channel, The Upper Hand. Today we're just going to continue on with our assessment trend as we've been doing over the last few weeks, and we wanted to talk about a very simple one, and it's the outcome measure that we give to our patients as soon as they come in the door for the first visit, as well as at the last visit, and that is the QuickDASH outcome measure. We'll talk about a little bit about what that is, how to score it, and just a few other things to note about the QuickDASH. So let's get started. So there's a longer version of the QuickDASH, and it's just called the DASH, and what that stands for is disabilities of the arm, shoulder, and hand. And what that is it's a questionnaire that the patient will fill out, and it contains 30 questions. At our clinics, the QuickDASH usually suffices, and we can just use that one instead. It's only about 11 questions, so it goes a lot quicker for the patients to fill that one out. So this questionnaire is a self-report questionnaire, so validity is always an opponent to consider while giving this assessment. This assessment is set up in the 11 questions that we mentioned earlier as a 5-point Likert scale, and I'll show you a few pictures of those later in this video. But the QuickDASH is a questionnaire that measures an individual's ability to complete tasks, absorb forces, and as well as the severity of symptoms. The QuickDASH tool again uses that 5-point Likert scale that we mentioned earlier, from which a patient can select an appropriate number corresponding to his or her severity/function level. So before we go into the QuickDASH and what all questions that come with that, I did want to mention that for both the DASH and the QuickDASH, there are optional modules for work, for some of your workers' compensation patients, and there's also an optional module that we don't always do, but it's available if we need it, is a sports or performing arts module. Those consist of 4 questions each, and each question must be answered to be able to grade that correctly. So let's go ahead and talk about the QuickDASH, kind of what the questions are, how that looks. So if you'll look at the very first page, it says questionnaire asks about your symptoms as well as your ability to perform certain activities. We always encourage patients to answer every question based on your condition in the last week. So what that means is patients will often say, well, it hasn't really hurt me today, or I haven't had trouble with it today, but yesterday it was really bad. So we kind of want the patient just to give a good average answer over the past week. We also tell the patients if you did not have the opportunity to perform the task or activity that it's asking about, then to just give your best educated guess on how you would be able to perform that activity at this current point in time. And one more thing is we do just ask the patient to answer based on their ability to perform the task, and it doesn't really matter which hand that they're doing it with. So for example, if they are right-handed, right hand dominant, and they hurt their left hand and they don't cut food with their left hand typically, we don't want them to answer it like that. We want them to answer it like they're normally doing it with their right hand. So that would be no difficulty or minimal difficulty. So if they answered that considering trying to do it with their left hand, obviously that's going to be very difficult, not only because of their injury, but because they don't do that typically with that hand. So one other thing to talk about before we get started looking at the specific questions of the QuickDASH is how to score the QuickDASH. And I just want to make one note about that the patient has to answer minimum 10 questions before this QuickDASH can be scored. If they only answer 9, then you're going to throw that out, or just make sure you catch that before they leave the evaluation and go ahead and have them fill out those last few questions that they missed. So if you do as many as we do, you're going to memorize that formula and be able to do that in your head pretty quickly. But that is at the bottom of those for if you need that. So let's talk about the specific questions. And again, we talked about it being a 5-point Likert scale. meaning number 1 means no difficulty, 2 means mild difficulty, 3 means moderate difficulty, 4 means severe difficulty, and 5 means unable. Now that is your scale for the first 6 questions, and then they will change slightly throughout the rest of the questionnaire. So for the first 6 questions, open a tight or new jar, doing heavy household chores like washing a wall or a floor, carrying a shopping bag or a briefcase, washing your back, using a knife to cut food, recreational activities in which you take some force or impact through your arm, shoulder, or hand, and it gives examples there such as golf, hammering, tennis, etc. Number 7, that's when your scale changes just a little bit. As you can see, it says 1 is not at all, 2 slightly, 3 moderately, 4 quite a bit, 5 extremely. Number 7 says, during the past week, to what extent has your arm, shoulder, or hand problem interfere with your normal social activities with family, friends, neighbors, or groups? Number 8, during the past week, were you limited in your work or other daily activities as a result of your arm, shoulder, or hand problem? This is one if someone rates that they were unable to do their work or very limited, even moderately limited, this may be a patient that would be good to give that optional work module to see if you can kind of dig a little deeper into that question. So number 9 is just going to ask them about their pain, their arm, shoulder, or hand pain. Your scale there is going to be none, mild, moderate, severe, or extreme. Number 10 is asking about tingling, pins and needles in your arm, shoulder, or hand. Same scale there. And then your last question, number 11, your scale is going to be no difficulty, mild difficulty, moderate difficulty, severe difficulty, which looks the same as the very first category that we did, the first 6 questions that we did. But the last one is so much difficulty that I can't sleep. And the question there is, during the past week, how much difficulty have you had sleeping because of the pain in your arm, shoulder, or hand? So you have the patient fill that out. I like doing it at the beginning of the initial eval before they even see us, the therapist. And I like doing that at the very end of their treatment, like when we're about to discharge them, and kind of compare those two to show some pretty good improvement there. Anytime you're treating a Medicare patient, every 10 visits, you're going to have to redo this form and have the patient fill that out again. And you hope to see some improvement in that score, but again, it's a subjective assessment, so you may not always have the most accurate or reliable information. So you have to just take that for what it is. One thing I would suggest, if you use this assessment quite a bit, is to come up with a little cheat sheet on your grading scale. It will save you a lot of time if you can just have that out. Again, I'll include that in this video to show you kind of what that looks like, but it takes you maybe 10 minutes to do, and it will save you a ton of time in the future not having to do this calculation from this formula every single time. Hey guys, thank you so much for taking time out of your day to watch this video. We hope you learned something today and that this was helpful to you in some way.
So you know our goal for this channel, The Upper Hand, is to give you guys the upper hand as you seek to better understand conditions of the upper extremity and just all topics related to occupational therapy in general.
So please take a second out of your day, make sure you like this video and subscribe to this channel so that you can be sure that you're going to see all of our upcoming videos. Thank you guys so much, and we'll see you next time.